They want PRP to cure arthritis. You know that's not how it works.
PRP or cell therapy, it's not a miracle cure. It doesn't guarantee that it will cure your disease or create full recovery of your condition.
So how do you educate without discouraging and still close the treatment plan? Find out now.
Speaking of managing patient expectations, how do you use the art and the science to manage your patient's expectations for PRP, BMC, MFAT? How do you, because, we all have those patients that come in and expect that this stem cell therapy is going to be curative. And so how do you kind of lay crepe, but also we're in the business of selling this procedure. If we don't sign them up for this, we have less money in our bank account. And they're in there asking for it. So how do you manage both the desire to help and the expectations that maybe are a bit overzealous?
Right, that's always an art, as you said. But you just said the first important thing when I talk to my patients regarding managing expectations is that PRP or stem or cell therapy, it's not a miracle cure. Although it can aid in tissue healing and pain relief, it doesn't guarantee that it will cure your disease or create full recovery of your condition. So I always tell them, especially for my patients who's got moderate to severe osteoarthritis, this will not get rid of your arthritis. It might improve the quality of your cartilage. It will improve your pain and function based on a lot of studies that has been published, but it's not gonna probably make your MRIs better. And then their next question would be, well, there's some studies that has been published with before and after MRIs with improved changes in the cartilage quality, or even second look arthroscopy wherein they showed some improved cartilage quality. So there's that, but I can't guarantee that that's gonna happen in this scenario. I can tell you there's probably a 75% chance that will be successful for your mild to moderate osteoarthritis, worst case scenario, if you do all the right things. And so just kind of feeling out the patients, because as you said, there will be some patients that will come in the clinic and say, you're going to regenerate my cartilage, you're going to get rid of my osteoarthritis. And those are the ones that you got to kind of squash right away. You got to tell them, no, that's not what I'm going to do, but this is what I'm going to do. The other thing that I tell my patients would be that this is not an instant relief procedure. This is something that will result to gradual improvement, that it might take 2, 3, even 4 months for you to get the full benefit from it, or even later, especially for spine, and that you'll feel worse first before you feel better. There's a few days, maybe 1 week if you're really sensitive, that you're gonna feel more achy than your normal regular pain. So if you're okay with that, then this will be the treatment for you. Because once you get to that point, you'll be good until you injure yourself again. There's more longevity to your treatment. The structure or the body region that we are treating will be stronger, will be more stable, so you're gonna be able to do more. So kind of balancing the expectation and also what the treatment can do. You still tell them that, oh, this is better than whatever we have right now. We're going to inject you cortisone, you'll feel great for 2-3 months, but then you'll be back and your cartilage, your knee joint is probably worse at that time. So just kind of balancing that and again, feeling out your patients. Some patients will hear what they want to hear, and those are the ones that you're just gonna have to repeat to them what the expectations are for the treatment.
Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us.